First, though, let's go to central London, where we can speak to the Communities Secretary Robert Jenrick. Thank you for being on the programme this morning, Mr Jenrick. I just want to start with the government's new slogan, because when the government told us to stay at home, protect the NHS, save lives, everyone knew what that meant. It was very effective messaging. It worked. I have to be honest, now that stay at home has been replaced with stay alert, in practical terms, I don't really know what that means. Can you explain?
Well, good morning, Sophie. And I think as we've now passed the peak of the virus, it's right that we update and broaden the message to the public. I think that's what the public want, and that they will be able to understand this message, which is that we should be staying at home as much as possible. But when we do go to work and go about our business, we need to remain vigilant. We need to stay alert. And that means things like respecting others, remaining 2 meters apart, washing your hands, following the social distancing guidelines, because the virus continues to be prevalent. Too many people are still dying of this, and we're going to have to live with it for a long time.
My point is slightly that stay alert is so vague, it's bordering on being meaningless. I mean, you could stay alert while staying at home, you could stay alert and go to work, you could stay alert while having 20 of your friends over for a party. Is there not a danger that this is so woolly that it could apply to anything?
Well, I hope not. The message that the public have adhered to very well for the last few weeks of staying at home now does need to be updated. We need to have a broader message because we want to slowly and cautiously restart the economy and the country. This will be a cautious approach.
So you want more people to go back to work?
At 7 o'clock this evening. Well, I won't preempt what the Prime Minister is going to say tonight. He's going to be setting out the roadmap for the weeks and months ahead. But it will be cautious. We're not going to take risks with the public. I understand people are anxious about the future. But we want now to have a message which encourages people to go to work, as we begin to ease some of the lockdown measures, to take advantage of those, but always to be cautious and to be alert. And that means, as I've said, continuing to adhere to the social distancing guidelines. And staying at home will still be an important part of the message, but you will be able to go to work, and you will, in time, be able to do some other activities that you're not able to do today.
OK, I understand you probably don't want to preempt too much of what those other activities will be. We've all seen the pictures over the sunny bank holiday weekend of people stretching the rules of the lockdown, in some cases pretty clearly breaking the rules of the lockdown. Is this not really the time to ditch the stay-at-home message?
Well, as I've said, staying at home will still be a very important part of our message to the public. But people will also need to go to work. They'll need to go and do essentials like buying food and medicines and looking after vulnerable people where it's necessary. And when they do that, they need to be responsible. And by and large, the vast majority of the public are being responsible today. That's why the message that we've had for the last few weeks has been relatively successful. It was important that we had the parks open so that people could get out and exercise and could get some fresh air. We want to see that continue. We want to give more avenues for people to get out and about so that life can be more livable and more bearable as we learn to live with the virus and move into the next phase.
OK. Now, you're also introducing this new 5-tier alert system for COVID-19, a 1 to 5 scale. Can you just explain exactly what it is and how it would work?
Well, I think many people will be familiar with the threat level that we've had in this country for some time, which measures the ongoing threat of terrorists and other risks to our safety. And this is a similar threat level, which will be known, it will be very transparent. People will be able to see at what point we are in controlling the virus. At the moment, we believe the country is at 4 on a scale of 5, with 5 being the most concerning. And our aspiration is to bring that down as swiftly as we can to 3. And at each stage, at each of those milestones, we'll be in a position to open up and restart more aspects of the economy and of our lives. We're going to be rigorously monitoring our performance against that, and, as I say, setting that out as transparently as we can. That will be done on a national scale, but the evidence behind that will also be able to inform what we do at a local level. And if we see that there are outbreaks in particular localities, neighbourhoods, schools, towns, then we may be able to take particular measures in those places as we build up a more sophisticated and longer-term response to controlling the virus.
Interesting to hear that there's going to be kind of a regional aspect to it too. I just got a quick question on the PMs Road Map that he's going to be setting out later. I know you're not going to want to go into details, but can you just give us an idea of the flavour of what he might say, but also, crucially, is this just going to apply to England or will it also apply to Scotland, Wales and Northern Ireland?
Well, our strong preference is that the whole United Kingdom moves as one, and the Prime Minister has been working closely with the First Ministers, and you'll be speaking to some of them shortly. There'll be a COBRA meeting later today, which will include them, as always, and we hope that they will agree to a consistent approach across the country. That's our strong preference. But the Prime Minister's message, and I won't preempt exactly what he's going to say, you'll have to forgive me, but his message will be to thank the public for adhering to the social distancing guidelines over the last few weeks. We have now passed the peak. The virus is on a downward trend, but it's still very prevalent. Too many people are still dying of this, and so we have to adopt the cautious approach that he's going to be setting out. We will be looking to restart and reopen the economy and the things that we all miss in our daily lives, but we'll be doing that with great care and caution, and at every turn monitoring the impact that has on the rate of the infection within the community, and the steps that we take will be conditional on keeping the virus under control. If there are outbreaks in one particular place or another, then we'll have the opportunity to increase measures and control the virus again. This will be a cautious approach, but we know that the public are anxious, are concerned, but equally want to begin to get back to work, get back to their daily lives.
Just listening to what you're saying there about the rate of infection, the R rate, about the 1 to 5 scale, it's pretty clear that the government's going to be using data as much as possible in the coming weeks and months to inform policy. So I just want to have a look at where we are when it comes to using that data and the government's record on it. You're currently trialling a new NHS app on the Isle of Wight, which would alert you if you come into contact with somebody with coronavirus. The FT reported on Friday that we're now developing a second new app complying slightly better with rules from Apple and Google. Is that true? Is there a second app because the first one wasn't good enough?
No, we're piloting the app that we have produced, and we went down the path that we did because we wanted an app that was different to those that you see in other parts of the country, parts of the world, because it could have more localized and therefore more useful data. That pilot, I understand, is going well. About 50,000 people already have downloaded the app in just 1 week on the Isle of Wight. So that's a great response, and we're very great. I think that's about 40% of the population on the Isle of Wight. So that's very strong. Remember, this is only in a week, so we're very grateful for islanders for responding so well. I hope more listen to this programme, and in the days ahead will download the app and we'll get up to our target. But we're also, it is correct, that we're also looking at what other countries are doing. And if we need to learn lessons from those, obviously we will do. We want to have the most effective app that we can possibly have, and we'll learn from the pilot in the Isle of Wight before we roll this out across the rest of the country.
So it could change then, effectively, the app, because at the minute the data is stored centrally in the app you have, but there is pressure to perhaps have a decentralised approach because of privacy concerns, isn't there?
Well, this is a pilot, and as I say, one of the things that appears to be going well with the pilot is that many people are downloading it. We saw some of the international examples.
Although not the 60% that you need currently.
Well, with respect, Sophie, it's been a week, and we've got 50,000 people who've already downloaded on the Isle of Wight. So I think that's very good progress. We hope we get more in the next few days. But we'll learn from that pilot, and then we'll roll it out across the rest of the country.
OK, now you're also hiring 18,000 people to do contact tracing, which is another important part, of course, of the test, track and trace approach that the government want to see in the coming months. So how many have been hired so far?
We don't have a figure, or I don't have a figure for that this morning, but we are hiring those individuals. We're building the network across the country. We're working now with local councils as well, so that we can use their expertise, the public health experts that they have as well. That, with the pilot on the Isle of Wight and with the increasing capacity within testing, is building the network that we will need as an essential element of our strategy moving forward to control the virus and to have the best possible data as to its progress in all parts of the country. And we're going to be announcing later today, the Prime Minister will be saying more, that there will be a centre for biosecurity that will bring this data together, monitor the progress against the virus in all parts of the country and inform our response if, as I say, we're able to move to the next level on the scale that we're setting out, or if there are particular places that might need more measures put in place to protect the public there and prevent an outbreak broadening beyond one neighbourhood or locality.
OK, pretty clear that the government doesn't want to tell us how many people have been hired so far for the contact tracing. How about the testing? Because that, of course, is another big part of it. People getting the test to show whether or not you have coronavirus. The government did hit its 100,000 tests a day target, but then missed it for 7 days in a row. Is it true that tens of thousands of tests were sent to America because of problems in UK labs?
Well, testing capacity is over 100,000 now. That's a huge increase from a month ago. We've gone month by month from 2,000 capacity to 10,000 to 100,000 capacity, and now we're moving forwards, and the Prime Minister and the Health Secretary set a target of 200,000. So we are making good progress there, and that's a level of testing that's comparable with other countries in Europe and around the world who have good responses to the virus. There was an issue with one of the labs, and we put in place our contingency plan, which was to take some of the tests to the United States for the testing process, and that was exactly in line with the detailed plans that the Department for Health had made in advance, and actually just demonstrates the fact that we're so determined to increase the amount of testing that we'll do steps like that to get the test results done, wherever that needs to be done, and get those results back to members of the public as quickly as we can.
OK. Now, one of the things that, of course, is really important in the government's response is tracking the R number, the rate of infection, effectively how many people each infected person passes the virus onto. And if it becomes more than one, then that's very troubling indeed. So some are asking whether or not that's ticked up in the last days, which has limited what the government can do. So can you just tell me what is the R number, and specifically, what is the R number in care homes?
Well, the Prime Minister will set out more about the rate of infection and how we intend to monitor that later today. The R number is a range today. The last scientific evidence that I saw was that it was between 0.6 and 0.9. There are different rates of infection within the community and within care homes, as indeed there are different rates of infection in different parts of the United Kingdom. So it's not quite as simple as just saying there's one R number for the whole country. But the important thing, as you say, is that we control the virus so that the rate of infection doesn't rise above 1 and then starts to grow
so what is it
exponentially. And that's, that's at the heart of our strategy.
Can you tell me what it is in care homes?
The R number is, I don't have the exact figure for the R number within care homes, but we do believe that the rate we've passed, or passing through the peak of the infection within care homes, and that we're starting to be on a downward trend within care homes. That doesn't, that's not to downplay what's happening in care homes, because it's a very challenging situation there, and that's why we're putting in place a comprehensive, coherent strategy for care homes, the testing of patients and residents, including the asymptomatic, new discharge policies so that the NHS doesn't bring people back to care homes unless it's clear that they're free of COVID, more personal protective equipment, and ensuring there's more support both in terms of NHS, local council and financial support for care homes across the country so that we can wrap our arms around them in the days and weeks ahead.
You say that you want to wrap your arms around care homes now, but I just wonder if the government has done enough to wrap its arms around care homes in the past. And the reason that I'm focusing on care homes, as you'll know, is because, frankly, what's been happening there is pretty heartbreaking. One of the government's successes is the fact that the NHS hasn't been overwhelmed, but we've seen cases before where older people, vulnerable people have been sent back to care homes from hospital, even some with coronavirus, which is then spread in care homes. So my question to you is, has care homes been sacrificed in order to protect the NHS?
No. And we are putting in place the measures that we need to address some of the concerns that you've just outlined. For example, better discharge policies, so that you don't return to a care home until you're free of coronavirus or 14 days have passed. Less movement of staff between care homes, so that you can limit people coming into care homes who might have coronavirus, for example, without knowing it if they were asymptomatic or the symptoms hadn't yet manifested themselves. And a bigger package of support for care homes. It was always going to be more challenging to support care homes. There's more than 15,000 of them across the country. They're in many different hands. Many of them are privately owned. But we're now ensuring that there are the procedures in place, there's better support from the NHS, from GPs, district nurses, local councils, and also that they've got the financial support as well to ensure that the amazing work that's going on there can be sustainable in the longer term.